Everyone wants to stay out of the hospital and recover at home. Now, an innovative computer-based medical home healthcare system allows patients to live comfortably at home and be closely monitored and safe. Ramon de Maculangan, president and founder of Saguaro Healthcare, with over 25 years of home health experience, tells us about the development of this exclusive home monitoring system and what kind of patients are successfully using it.
Our role in home health care is to receive orders so we can act immediately to a patient condition. Most of our patients have chronic comorbidities, chronic conditions, and they need to be managed at home. But what has been happening is that there's a delay from an onset of a new condition to the time that the doctor is able to respond to and create a new care plan for that patient. We're using several technologies. One is cloud technology. Second is Internet of Things technology. And also we're doing animation technology. What we're doing is we're integrating some sensors, including signs and symptoms, so that we will know immediately or quickly that the patient's status has changed and that we're enabling a doctor to come up with care modifications so that the patient remains at home. So what we wish to do is to prevent an unplanned episode in the hospital.
Dr. Rosner Luss explains how technology is linked to improvements in patient care.
Technology in healthcare is very important. It bridges the gap between patient care and the demands of healthcare these days, period. This allows us to treat a large number of patients successfully. The importance of staying in home for a patient is crucial. The quality of life, longevity of life are impacted. And patients are happier, the families are happier, and patients tend to do well long-term better when they're at home. This program is sort of like being the monitoring system for someone's health and vital signs. So I believe patients are going to really enjoy this program.
Many health indicators are monitored using this system.
A patient would have a blood pressure, that's for sure. Then a temperature, oxygen saturation. Also, you have scale and blood sugar. So all of these would be able to monitor events in the patient's clinical journey, and we could see immediately some worrying trends. In addition to that, a patient would have signs and symptoms so that at any given time of day, they can relate or tell us how they feel. Maybe patient has a headache, has a cough and chest pain, so immediately we would know what's going on. And more than that, we also have fall detection, because falls is something that happens to a lot of the patients while they're recovering at home.
For family members, this program will give them a lot of confidence that somebody is watching over their loved one. There's a team helping monitor your loved one. This is going to be revolutionary.
This medical home monitoring system allows patients to become actively involved in their health care.
We have a patient that was referred to us, and upon admission, the blood sugar is 600. And because of the telehealth, they came face to face with the results on a daily basis. So by doing that, he started adopting things that would lower his blood sugar. And by the time we discharged that patient, blood sugar was down to 180. What really gladdens our hearts is because this patient was able to be successful in controlling her diabetes.
Dr. Luss outlines more of the advantages of this home monitoring.
One of the special aspects of this program is that once the outside monitors recognize a fall, an elevated blood pressure, or a complaint like a headache or chest pain, the patient can be conferenced in with me almost immediately through my iPhone, iPad, or their iPhone and iPad, and we can interact and come up with a plan immediately.
One of the beautiful things that the system has a medication reminder. This medication reminder changes as often as the doctor changes the medication for the patient.
Home health monitoring is beneficial to patients and their families.
This system is an answer to most of the gaps in healthcare. So when we leave these technologies, okay, we have a way of looking at the patient's condition on a 24/7 basis, because the disease process is like a thief in the night. It just comes in without any warning. And what we want to do is to catch it when it happens. And maybe by doing so, prevent a hospital episode in the process.